So good morning, good afternoon, and good evening to you all, depending on where you are joining us from. And welcome to today's AMR Community of Practice Echo session. My name is Sylvester Moyo, and I'll be your moderator for this session. Today's presentation is titled Modeling Societal Burden of Antimicrobial Use or Antimicrobial Resistance, Introducing the Productivity Adjusted Life Years, or PALYs in short. Now, before we dive into today's topic, it's very helpful to recall two common measures that are used in public health, and that is the DALYs and the QALYs. So the DALYs, or the disability adjusted life years, this really measures the burden of disease by combining the years of a life lost with the years lived in poor health. Whilst the QALYs, or quality adjusted life years, measure the benefit of healthcare by combining how long someone lives with how good those years are. These are two important tools for comparing health outcomes. And if you're not familiar with them, or if, like me, it has been a while, I encourage you to take note and perhaps do a bit more reading after this session. In today's webinar, Prof. Mumba will expand on these top concepts and show how they can be adapted into what we call PALYs, or productivity adjusted life years, for livestock in this instance. So this will help us capture the economic and productivity burden of AMR in animals specifically. We will also explore how new modeling approaches like PALYs can help us better estimate the economic and societal burden of antimicrobial use and antimicrobial resistance in livestock, and also why this matters for both animal health and public health decision making. Before we start, just a few housekeeping points. We have simultaneous interpretation available from English to French. Please select your preferred channel on the Zoom toolbar. Please use the question and answer function for questions you would like to ask our presenter today. And please feel free to use the chat box for comments and reflections you would like to share as we go along. Today's session is also being recorded and will be made available on the ASLM website, and the link will be shared via the email that you used for registration to attend this session. It is my pleasure to introduce today's speaker, Prof. Chisoni Mumba, who is an associate professor of animal health economics at the University of Zambia's School of Veterinary Medicine. Prof. Mumba holds a veterinary and economics training from the University of Zambia and a PhD in animal health economics from the Norwegian University of Life Sciences, specializing in systems thinking. His research focuses on animal health economics, systems approaches to AMR, risk assessments, and participatory epidemiology. He has supervised and graduated numerous postgraduate students, published over 60 peer-reviewed papers, and has been very instrumental in strengthening Zambia's postgraduate education and research systems. His applied research has also had real-world impact in forming livestock policy, food safety improvements, and AMR risk-based inspections at border crossings. We are honored to have him with us today in this session. Prof. Mumba, nice to have you, and over to you.
Thank you very much for that wonderful introduction, Sylvester. So I will talk about modeling societal burden of AMU and AMR. And here I just want to show you a picture of the School of Veterinary Medicine at the University of Zambia, which is collaborating with ASLM under a project called Technical Assistance for Data and Evidence. We are therefore providing technical assistance at the national level, but also helping other countries with assistance on data and evidence. In terms of the overview, like Sylvester said, I think some of you are quite aware that in public health, mostly the burden of antimicrobial resistance and use has actually been widely captured. And I want, to make mention of powders and others who have actually done a systematic review to capture everything that has been done up to 2023. Sorry about that reference. In terms of AMR in animal health, when we talk about burden. And mostly in animal health, they have correctly captured increased healthcare costs. Talking about AMR, in relation, AMR burden in relation to prolonged duration of hospitalization. We know that, when these antimicrobials fail to work on diseases, you spend more time in hospitals. You can come out, but perhaps you'll be readmitted. Instead of being in the hospital for 10 days, you find yourself being in the hospital in 21 days. But then this is affecting productivity on your side. You could be a breadwinner at that particular point, and your family will be, disadvantaged because of, your illness, which is not responding to treatment because of AMR. But also they have captured the death. If you talk about impact in terms of death, we do indicate that so many people have died because of AMR, and therefore this is costing so much as an attribution of AMR in human health. But also in terms of just incidence, in this case, morbidity, the number of people, who are just getting ill, and of course their quality of life, being reduced because of illnesses that are not responding to antimicrobials. However, this is not widely captured in animal health. We conducted a systematic review to assess what data is available globally on economic burden of antimicrobial use and resistance in animal health. And our findings actually showed very little evidence in terms of availability of studies, availability of analytics, availability of methods that have been, developed to assess the societal burden. What is there is mostly just talking about the cost of antimicrobials. Because of failure to respond to treatment, you have to spend a bit more on treating your animals. And generally also talking about diagnostic tests. How much are we spending on the diagnostics tests? For example, ASTs. How much are we spending on antimicrobial diagnostics? But also not forgetting the mortality. I think this is a direct cost that all of us will capture, that no 10 animals or 50 of my animals have died because they have failed to respond to treatment. All the antimicrobials that we have used are not really helping. It was because of this that we thought of coming up with methodologies, or indeed integrating or making use of methodologies that are already there. They have been developed, but they have not been applied. So we looked at integrating two methodologies: the animal health loss envelope, which was developed by Martins and others last year. This is under the global burden of disease, animal disease project, the GBUDS. I think some of you have read papers coming from GBUDS. But this has not been tried in terms of assessing the burden of antimicrobial resistance. We also looked at productivity adjusted life years. Now, since DALYs have been used in humans, can we modify them so that they are used in animal health? The concept is the same. The outcome is the one that will be different, because we know that in humans, humans are the same. But in animal health, you have different species. So the way you are going to look at DALYs or PALYs, DALYs in humans and DALYs in animals will be different. You have to look at DALYs of chickens, which we know that the output from chickens could be meat or eggs. You have to do perhaps DALYs in cattle. Within cattle itself, you have draft power. Within cattle itself, you have milk. Within cattle itself, you have meat as the end product. So these differences, therefore, required a modification, because you can't use DALYs which are fixed on one outcome in animal health. Therefore, we started looking at the animal health loss envelope, which is basically a metric which is looking at 3 components. Looking at expenditure in animal health due to antimicrobial use. Remember that antimicrobials are very important when we talk about production and productivity in animal health. Disease is perhaps the #1 threat, not only to production, but also to trade. A lot of countries, mostly in developing countries, cannot trade with other countries, mostly because of disease. Therefore, antimicrobials play a very important component of production and productivity in animal health. But at the same time, use is desired, but we have a negative externality, which is resistance. Because when we are using these antimicrobials, what we want is the animals, to get better and perhaps improve productivity. But then we have the unintended consequences, which is basically antimicrobial resistance. Therefore, it also looks at production losses due to mortality arising from antimicrobial resistance, and production losses due to morbidity arising from antimicrobial resistance. And this is therefore, compared in a scenario of without resistance and of course with resistance. And then we can come up with a financial impact and say, this is what it is costing to have resistance in this. And we are using, in our case, we are using a case of mastitis in commercial dairy farms. In terms of the data needs and potential data gaps, here I'm simply showing what category of data we are looking at and then what is needed. So just an example, in terms of use, we are looking at data on antimicrobial types and quantities that are being used in livestock. We're talking about retail price of antimicrobials that are being used. And what are the potential data gaps? This is very important. When we are developing this, there was a proposal from the collaborators and the funders that why can't we also, apply this, therefore, in smallholder dairy farms or indeed, small scale cattle production. But I think our main concern is that the data gap, the potential data gaps, which are very serious. So we said we'll start from commercial dairy, a commercial setup, which has, good or proper data, recording practices. And then as we go, try to see how we can come up with assumptions to account for the missing data or the data gaps in the small scale production. So this looks at production losses due to mortality, production losses due to morbidity, and then of course health expenditure and many others. Now this information will be captured using a questionnaire that will be administered to different selected commercial dairy farms in Zambia. Coming to the DALIs, DALIs basically stand for disability adjusted life years. Like Sylvester said, you have two common measures in animal health in terms of morbidity and mortality. So you're talking about QALYs, which is quality adjusted life years, and of course DALIs, which are disability adjusted life years. DALIs are actually an opposite QALY. This is a common measurement unit for morbidity and mortality, meaning that instead of just looking at impact because of mortality, that may not capture morbidity. But not only this, in terms of livestock, you see that you have a lot of benefits. You have a lot of purposes of keeping livestock. Some people keep livestock mostly just for prestige. Okay, and then you see other parameters being affected but how do you capture morbidity and mortality and the entire burden in the society? So this facilitates comparison of all types of health outcomes. You may ask, how are they constructed? They're basically constructed based on two things: quality of life reduced due to disability. And when you talk about disability, we are talking about the disability that is caused by a disease. And in this case, we are looking at the disability that is caused by antimicrobial resistance. And we are looking at mastitis as a case study. So here we can simply say quality of life reduced due to AMR resistance, what I would actually call antimicrobial resistance mastitis. We are not boiling down to the specific causative agents, but we're just looking at AMR mastitis. And then the other component is lifetime lost due to premature mortality. Now, this cow was supposed to live up to 15 years, for example, and it would produce milk up to 15 years. And then because of this AMR mastitis, it dies at 4 years or at 5 years. How do you capture that particular loss, not only in monetary terms, but also in non-monetary terms? Therefore, DALIs can be expressed as years of life lost due to disability, or life reduced, or quality of life reduced due to a disability, and indeed years of life lost due to mortality. So this is combining both of them. Now, how did we modify these DALIs so that they could be used in livestock? And using a case of AMR, what I call AMR mastitis in this case, meaning resistant, mastitis. We looked at 4 parameters which are used in human health, but then modifying them to actually fit to be used in productivity adjusted life years. So the first one was standard lifespan or life expectancy. For humans, you may use WHO recommends 82.5 for females, and then 80 years for males. And of course, this is due to different surviving potentials, and this has been also discussed at length on some of its limitations. Then also modifying the disability weight in terms of severity of the disease, in this case, mastitis. Then discounting, because the value of life at different points is actually different. And finally, age weighting. And we are going to use the questionnaire to capture data that will feed into these PALI models. So maybe briefly to talk about how we modified the standard life expectancy. We use the same life table, which is called WHO Standard Life Table, which is actually used to estimate life expectancy. But what we did in this case was now bringing it down to animals. And in this case, we're talking about dairy animals. So here I'm just giving an example of standard life expectancy for cows, where we have cows in categories. So we'll be looking at cows in categories. We'll go to a dairy farm and categorize animals. For example, we'll say the number of animals that are between 0 and 4 years, or let's say 1 to 3 years. And then the next category, maybe 4 to 5 years. And the next category, just like that. And then apart from that, this X is actually the number of categories, okay? Number of groups of animals in those particular categories. And then we have the N itself, which is number of cows now at that age. So if we're talking about a category of 0 to 4, how many cows are, in this category of 0 to 4? And in terms of mastitis, we have the DX here, which we are calling what is the death rate, okay, of animals in this age group due to mastitis. And then we look at what is the probability of survival at this particular age group, or in this particular age group when they have, mastitis. And the probability of dying. And then finally, this is going to give us the life expectancy that will feed into our PALI models. So for example, I will just look at animals in category 3. In this case, we are saying if there are 101 animals with a death rate being at 4%, okay, then it means that the life expectancy that we use at this particular, or in this particular age group, is 11.51 years. And this is what is fitted into the PALI models or PALI equations, which you are going to see. Then coming to disability weight. Disability is basically inability to perform the task which you do on your day-to-day basis. Okay, so if I work in a farm and I am sick, because of that particular sickness, depending on the severity of that particular sickness, I cannot perform. Or if I perform it in 3 hours, then in this case, I perform it in 1 hour because of this particular disability. So weights are given to, different disabilities or different diseases. In this case, it's between 0 to 1 when you're using DALIs, 0 being perfect health and 1 equivalent to death. So how are we coming up with these disability weights? So we are using this method that was published by Omran Saleh and others in 2024. Where, for example, here, our interest is milk production. So I'll look at number 2, just in level 1. Remember that we're between 0 and 1, 0 for perfect health and 1 for death. Meaning that If we say the average daily production or milk production in a healthy condition before mastitis is 20 liters, and then we see a reduction by 10, how do we allocate a disability weight, or which category does that particular productivity or fall in? Okay, then you say okay, 0.01 to 0.33, then it means that this is the weight, and it goes on to actually almost a near death. We're saying 0.67 in the last or fourth line here, or row, and then we say milk production has reduced, from 20 liters to perhaps 2 liters, and therefore this is very severe, and that's the disability weight which we make use of in the equation. Coming to discounting, again, here we use the same discounting function which is used in human health, but in this case, we are changing the discount rate to be able to obtain the same, effect in the number of years of life lost due to mastitis. So we are using an exponential decay. And with this equation that we have here, where gx is an exponent of discount rate multiplied by x, where R is basically a discount rate at the edge of x. So let's say at the edge of 4, and then this you'll see how this is also applied in the equations. And then the last modification was on age weighting. Because again, just like in humans, you agree with me that the value of years lived during a productive age is based on economic and social value in humans, but also in animals. You produce more at a certain age, and therefore we can't give your life the same value when you are 2 years old and when you're 30 years old. It's the same in animals. We can't give it the same value if this dairy cow is 1 year old or 2 years old, and the one which is maybe at peak production at 4 years old. Therefore, we are introducing two parameters here, which is B1 and B2. B2 being constant, and then B1 itself changing based on this graph. So for example here, let's say a cow that is 5 years old, it is going to use a discount rate of 0.8, but of course keeping a constant in this case, which is B2, which can be constant. In this case, we're using 0.01, but depending on the findings or average weights or ages, in terms of the age at which these cows become very productive, this is going to be adjusted to take care of the required parameters. And this will also be collected using questionnaires, because it is context specific. Now, after modifying these four parameters, then we go to the formulas that we are using to calculate productivity adjusted life years. The first one is a basic formula that is without age weighting, without discounting. And then the second one, we are providing a second scenario, which is parties with discounting, and then parties with both age weighting and discounting. So here is the first one, where years lost due to disability or years lived with a disability is basically N1 with a disability weight multiplied by the duration of the disease. So when a cow has mastitis, up to treatment, what's the duration of that particular disease? And if this cow, therefore, the causative agent is resistant to all the antimicrobials that are being used, by how long does this duration increase? And then we bring in duration here. And then the second equation, remember that we are adding total palis or total dalis are YLD plus YLL. So what we are doing to death, therefore, is bringing the years of, is bringing the number here multiplied by the standard life expectancy. So number of deaths in that particular age group, let's say the age group of 4 to 7, how many animals or cows died, multiplied by the life expectancy. And then we are going to add the this number, the YLD plus the YLL. Then the second one is now the palis with discounting. So here you pay attention again to the number of cows with, sorry, it's supposed to be with mastitis here, okay, multiplied by the disability weight for that particular disability, which is mastitis in this case. And we bring in the R, which is the discount rate, because we are putting in discounting. Depending on that graph which I showed, depending on the discount rate which will be used, depending on the data that is collected in dairy farms. And then, of course, this is multiplied by the duration of the disease. Now, we have duration of the disease without just mastitis itself, without resistance. And then we do the same with resistance. And when we come to the years lost due to disability or due to mastitis, what we are simply changing here is the life expectancy. So you will see that the life expectancy is going to change. The discounting rate is not there in this case. So I want you to see that here on top here we are using, in the first equation, we are using duration of the disease. And here we are using life expectancy because we are looking at the standard life expectancy at the age when these animals were actually dying. And in the last equation, now we are bringing in both age weighting and discounting. Again here, you will see that the B1 and B2 have been introduced, depending on the plotting of the graph and what data we collect at the farm. So in terms of the quality of life reduced due to mastitis itself, we are going to use the I. So the I is the duration of the disease. Okay, but in terms of, and of course the constant being B2, and what will change depending on the level or the age at which cows are most productive is actually the B1, the beta one, okay? The B1 changes when we plot on the graph. It's the same equation, but what changes in the second one, which is years of life lost, and this is due to death. We're talking about death here, or due to premature death or mortality. Here, instead of using I, which is the duration of the disease, duration of the disease is actually morbidity. Okay, you are not dying, but the disease is there. Then in the second part, you have died. So we are using the L here. Everything else remains the same, but the L, which is life expectancy at the age of death, for that age category is what changes here. And once we run our equations, therefore, we report our results. So how do we report our results for our productivity adjusted life years and animal health loss envelope? Let's start with PALIs. Now, again, these PALIs, remember that they are, even the data is analyzed at different levels using all the scenarios that we have. So here, just for example, if we have an age group of cows between 0 to 4 years, with a disability weight as this age group of 0.33 along all the categories, with the number of animals, for example, let's say the number of animals are actually 6 at this level, what will be the YLD in this particular category? So we have 4.18. Now, these are not results from our study. We are just demonstrating how these results will be presented. So here we are and saying, okay, we have 4.18 years lived with a disability, or years lost because of a disability. And then here we are talking about death with life expectancy here at 11.51 in that particular category. You will see that in the second category, in this case, life expectancy, keeps on coming down. Okay, and then you have the PALIs. The total PALIs basically 4.18 plus 71.14, which gives us 75.32 PALIs. And therefore, at the national level, if we have 1 million dairy cows in each category, then we can safely say, therefore, that this 75 multiplied by 1 million, therefore, antimicrobial resistant mastitis causes, hypothetically, we'll say 75 or 7.5 million DALIs. I think you have seen these parameters, or PALIs. You have seen these parameters in health or in public health, where when you look for impact of disease in a country where you are going to, you search for that information, you are told that in Zambia, for example, malaria causes 1 million DALIs. Here we want to be able to say that in Zambia, antimicrobial resistance causes so many DALIs in dairy, so many, and if we add up different types of livestock, we should be able to actually show the burden of the disease in terms of the societal burden of AMR in terms of animal health, in terms of AMR in animal health. So this is at a different level. Now, again here, we do a sensitivity analysis to bring in the effect of intervention. So if you tell me that the interventions that we are putting in place are farmer field schools, for example, by how much do farmer field schools reduce the PALIs in animal health? And then we should be able to say, at the global level, this particular intervention, when we apply it, be it antimicrobial stewardship, be it whatever intervention we are looking at, how much burden does it cause? And therefore, if we apply this particular intervention, by how much do we reduce the PALIs? But again, also comparing in terms of policy decisions, how do we prioritize allocation of resources? We have different diseases. In humans, let's say you have HIV, you have malaria, you have 10 diseases. You have so much resources, $10 million. How do you prioritize? which condition causes more burden in terms of DALYs? It should be the same case in terms of, animal health. We talk about AMR, we talk about this. By how much or how can we allocate these particular resources, not only in one type of livestock, but in different types of livestock. So when it comes to summarizing results, how are we going to summarize our results? So we'll have three categories of PALIs, like I showed you, basic equation without age weighting, without discounting, just using disability weight. Then you have PALIs with discounting, and then PALIs with both age weighting and discounting. All the three scenarios, okay? And then we compare the PALIs without AMR-resistant mastitis, and then the PALIs with AMR-resistant mastitis. And then we get the differences in PALIs. And then we can attribute that difference to antimicrobial resistance reported in terms of PALIs. We can also simulate the PALIs with mitigation measures. Say, okay, this particular mitigation measure or this particular intervention is going to reduce the severity, for example, from 0.33 to so much. Then we put that particular disability weight. Everything remains the same, but just by changing the disability weight, then it will actually show us the impact of the intervention. We can say that this particular intervention, maybe antimicrobial stewardship, reduces burden due to AMR by so many DALYs. So we will do these scenarios and also do some sensitivity analysis to make use of or to just demonstrate the various interventions. Now, these interventions will be based on studies that have been done in Zambia. A lot of work in Zambia has been done, supported by different, funders and different projects, which shows the interventions that have been applied at the national level. We are doing economic impact assessment of that in other projects like ICAS. And then borrowing from that data, we want to try to run those scenarios, and therefore also show to say, apart from just doing impact assessment based on gross margins, based on profitability, you can actually also demonstrate it at a societal burden level by using productivity adjusted life years. And then in terms of animal health loss envelope, this will be presented in monetary terms, basically the financial cost analysis. Now, here we are comparing use without AMR mastitis and use with AMR or with resistant mastitis. So this is basically what most people are doing, but doing it differently. Of course, people bring it at different levels to actually show profitability in a before and after manner. So baseline and endline studies that are being done in AMR, computed differently. Some use gross margins analysis. Actually, some use, I know the FAO team that is actually now using Probit and Logit models to actually show the impact of different scenarios in AMR. But the animal health loss equivalence actually comes in as a financial impact analysis to show the economic impact of AMR at different levels. I would like to thank you for listening, but to also just acknowledge the project team. So this project is done with colleagues here in Zambia. The PI is Dr. Ntombi Mdenda. We have Dr. Wizaso Mwasinga, Dr. Stewart Mdenda, and of course our assistants who are helping with data analysis. So we are doing it at two levels. I mean, the main output from the Zambian side is building an economic case for AMR surveillance at a national level, but also providing this technical assistance with other countries, that are doing similar work. And then the second part is doing the burden of AMR studies. So we have this team that is helping with data, collection. Of course, the collaborating partners, ASLM team, whom we are collaborating with in the third day project, and not forgetting UK Aid and Fleming Fund, who are the funders of this project. I would like to stop here and just share this for those of you who may be interested in getting my contact. You can just scan this and save the contact. We can have another comprehensive, perhaps, discussion at a different level. I thank you all for listening. Over to you, Sylvester.
Thank you very much, Prof. Mumba. I think that was a fascinating presentation. You have highlighted how the PALI model, adopted from DALIS, as you mentioned, provides a structured approach to estimating the burden of AMU and AMR in animals by integrating productivity losses, mortality, and also morbidity costs. This new approach not only helps quantify the hidden economic impacts of AMR, but also tries to bridge the gap between animal health and public health policy. So really, thank you again for that presentation. We now have some time for questions and comments. And Prof, I know that you mentioned in your presentation, you talked about aspects of age weighting and discounting. So there's a question that we have here from Amina Salihu, who says, interesting discourse. I would like to know how the human values, for example, the age groups, were converted to the animal values. What formula or methodologies were considered? So yeah, just highlighting that, I think you touched on it when you're talking about age weighting and discounting. Would you like to take that question?
Thank you. Of course, the basic framework is the human model. But you also know that, of course, in terms of life expectancy, the difference is quite big. We can't use the same. So we are using the same framework. But now us here, we are bringing a number of parameters. Like I said that, for example, using the death rate, using the age categories that we have. So if a category in humans, for example, is you're talking about impact of the disease between 35 to 40, there are other parameters that are being used. But here in animals, instead of using 35 to 40, much as you use the same discount rate, for example, but if I just bring where there's the 35 here, I bring an age category in the equation of 5 to 10, automatically it is going to give me a more reduced, proportionally more reduced discount rate. But again, it's the same. When we say we use, it's basically calibration. So when we use this graph again, exponential decay, and we bring in the years. So where I'm putting proportionally, if I say I was using 40 years, we know that animals don't live up to 40 years. So if 40 years to 50, and here, depending on the age categories that you use. So the age categories are very important here. You have to be realistic with your questionnaire in terms of assessing how long a dairy animal, if you're talking about a dairy cow, lives. Okay, and then you have different categories. You say, okay, for example, 0 to 4 years. So 0 to 4 years in humans, maybe 0 to, you're applying this to 0 to 20 years. Automatically, even if you are using the same discount rate here, you will see that it is going to reduce and give you a much lower, but also realistic, because you are using the same WHO life expectancy tables, but also using the same exponential decay in terms of age weighting. So it comes out automatically if you see those equations that I was actually sharing. When you put in those age categories for your cattle at the farm level, this will actually change. I hope I was clear on that, or I hope I have answered that question.
Yes, thank you very much, Prof. Mumba. I think that was helpful. We do have another interesting question. This one has already been partially answered, but just want to bring it up for the benefit of others who are also here. So there was a question from Rosa Kide, who was talking about the measurement of DALIs and mentioning that on the formula that you shared, they looked reversed. So just wanted to maybe start by saying, yes, so Rose, at first glance, yes, the DALI scale can feel reversed. Again, just a reminder, in the DALIs, a weight of 0 means perfect health, just as Prof. Mokhtar has responded. So 0 means perfect health and 1 means a state of equivalent to death. But then when you, because that is because the DALIs are actually reflecting a loss of healthy life. But I think, Rose, maybe you were also thinking about QALYs, because in QALYs now, the scale looks a bit flipped, where 1 means perfect health and 0 means death. So maybe to Prof, maybe just to also help, maybe expand on that, maybe I can invite you, Prof, to come through now to just, again, once again, explain how this conversion is now applied in terms of the Pali modeling for livestock. Thank you.
Indeed, it's basically the same. You have rightly put it, that a Kali is a negative DALI, or vice versa. So if you are looking at qualities, we are talking about the quality of life. With this particular intervention, how much are we improving the quality of life? And in qualities, 1 is perfect health, okay, with 0 being death. Now, since a DALI is an opposite Kali, therefore a DALI, perfect health is 0, and death is 1. And therefore you see the reverse. And you are very observant. That's very correct. And I think the simple explanation is what Sylvester also has given, that a DALI is basically a negative quali. So you can also do qualities in animal health, but then perhaps that would be after doing DALIs, then you ask yourself to say, at the policy level, now, how do we use it to prioritize intervention for improved, health outcomes? It would be interesting, actually, after doing DALIs, to think about, qualities on how we can also do the opposite. I don't think it would be automatic. I haven't actually thought of that. I don't think it would just be an automatic doing an inverse of the other. I don't think so. But I mean, it's something that is worth trying perhaps after this study that we are doing on productivity adjusted life years. Everything else is basically the same, other than those 4 parameters: age weighting, discounting, life expectancy. I mean, those are the ones that you modify. So the modification is coming with that. Of course, bringing in a lot of technicalities of every disease. Now, here is the difference again. If I'm applying these parties in chickens, they will not be the same because of the differences in terms of productivity, at large scale, at small scale, at medium scale, but also just the technicalities of a disease. Every disease has different, manifestation in different, perhaps different types of livestock. So the challenge that we have in vet is just like, human medicine. A human being is a human being. You're dealing with the same. When you come to animals, you find that paracetamol doesn't work in cats. You are going to kill the cats. So you have to bring in all those technical bits of different types of livestock, and also the way diseases manifest in the different types of livestock. But that's a very good question, actually, and a very
Yeah, no, thank you very much, Prof. Mumba, for that. So I would like to combine sort of like two questions into one. There's a question from Bill Erickson for PET, and a question from Richard Musonda that I'll just like to combine. So the first part is just saying, one of the interesting challenges that obviously are there with applying models like PALIs, as you have mentioned, especially in low and middle income countries, is that diagnostics testing is not always readily available. So the first question from Bill is saying, how is the process of attribution of productivity loss or mortality due to AMR done in low income settings where diagnostic testing is not readily conducted? And then just to add to that, Richard is then asking, have some countries already adopted the PALI estimates to guide policymakers in prioritizing AMR interventions in livestock? And do you think PALI could become a standardized measure for evaluating the economic burden of AMR in animals internationally in the near future?
Thank you. Brilliant questions. I'll start with the last one. Have other countries adopted that? The answer is no. We are actually perhaps the first ones. Of course, PALIs have been applied in tick-borne diseases. There's one study that was done in South Africa, and then we have also applied them in East Coast fever here in Zambia, and that work has actually been published. We're hoping that the GBADS project, because World Organization of Animal Health actually funded the global burden of animal diseases through the team led by Jonathan Rushton. That was at Liverpool then, but I think he has now moved to Edinburgh. So they did something, but they haven't, done PALIs. And the hope, actually, I was hoping that they would adopt the PALIs and maybe recommend them to World Organization of Animal Health so that they're adopted at that level, like the DALIs have been adopted by World Health Organization. But that has not been done. But perhaps, I think from this study, maybe we are slowly getting the conversation around that. It's technical assistance for data evidence. Perhaps with this evidence, with SLM, maybe we can start pushing, that agenda. Trying to nationalize and perhaps globalize, PALIs as a way of measuring global burden of not only antimicrobial resistance, but other animal diseases to that effect. Then the first one, in terms of diagnostics, yes, diagnostics for AMR in low middle income countries may be challenging. If we talk about, most of these are actually centralized now, meaning that you will not do it at the field level. And it's true, there's a big challenge. Simple susceptibility tests for antimicrobials, AST tests, will not be done at a field level. Okay, you'd have to collect samples. I remember Mokhtar actually asked about this to say, can we also maybe at these farms also collect, samples and run them in the labs to actually demonstrate that there is, resistance. But that would also have to be done at a centralized level. And true, the challenges of lab diagnostics, not only for AMR, but for all diseases in, developing countries, stands to be a challenge. Does that affect AMR research? Definitely it does. We are doing this at the research level, at the pilot level, and would want to see also how this can be nationalized. But yes. I think very important. I agree with you. Those will be some of perhaps the challenges of implementing not only AMR research, not only AMR diagnostics, but to all diseases at a national level. Not much of an effect when it comes to PALI models, though, because remember that these models can also use a lot of scientific assumptions. Of course, it becomes an issue of it's a debate also in terms of limitations of these PALIs to say, okay, without data from the lab, how sure are we that the attribution is perhaps very has high specificity, maybe in that case. But yeah, we can still do that, of course, with those challenges.
Sure. Thank you so much, Prof. Mumba. Unfortunately, due to time considerations, what we'll do is that there's a number of other questions that have been posted. Prof, my colleagues have been helping to answer these questions, but due to time considerations, what we'll do is we'll take note of all the unanswered questions and we'll get these to you, Prof. Mumba, so that you can answer them offline. And then we'll make sure that we also then share the responses as part of the resources from today's sessions. So we will attach a question and answer resource when we share the recording of this webinar as well as the presentation. So with that said, Prof, I will now ask you to just give us your closing remarks. Thank you.
Thank you very much, dear participants, for coming. But please, as you go back, perhaps a take-home message to say we can, in terms of assessing the burden of disease, we can actually now capture both the monetary and non-monetary burden. Remember that disease does not only cause monetary losses. There are people who use these animals for various purposes. Some for draft power. Other studies have demonstrated, for example, in the Zambian setup, when you have foot and mouth diseases, foot and mouth disease in oxen, we have seen that maize production in that particular area reduces by almost 40%, actually slightly above 40%. Of course, we can say this is the loss. Financially, you may not capture it, but in terms of a burden at a societal level, putting all these parameters into consideration, I think productivity adjusted life years are very helpful, and I hope will provide evidence that will be used not only by Zambia, but also by cooperating partners, collaborators, and at a global level, we start the conversation around the use of productivity adjusted life years. Those would be my closing remarks, and thank you everyone for coming.
Sure. Thank you very much, Prof, for that. Really, once again, Prof. Mumba, thank you once again for your excellent presentation and also for showing us how modeling frameworks like PALIs and also a new term for me, Animal Health Loss Envelope, or AHLE, can help strengthen our ability to capture the true burden of AMR. So before we close, please note that the recording and slides will be shared via email and on the ASLM website. And if you haven't already, we encourage you to join the ASLM membership, which provides access to exclusive resources, training, and future AMR CoP webinar updates. I would also really like to acknowledge and thank the Fleming Fund and UK Aid for making this webinar series possible. It has truly been an insightful session. Thanks again, Prof. Mumba. We look forward to seeing you in the next AMR CoP webinar. Otherwise, wishing you all a productive day ahead and a blessed weekend. Until next time, it's goodbye for now. Thank you.